I'm here in the Okanagan Valley in front of a pictograph put here by our first peoples, perhaps thousands of years ago. It tells a story. Assessments are like that. We are gathering a person's history. We are gathering a person's story. But the problem with doing an assessment is not getting information from a client, but what information do we want to pay attention to? There's so much that a client can tell us, so much that we can observe in a client. But how do we make sense of that? How do we make meaning to that? And particularly, what do we want to pay attention to? Sometimes I think of it like Michelangelo when he looked at a large block of marble, and in it he could see the Pieta or the David. And the challenge is, what do you take away so that you can get to the piece that's underneath? So when we do that with an assessment, we're trying to apply a filter to the information. And in cognitive therapy, the filter that we're looking at is trying to understand the client's belief systems. Where do those beliefs come from? What kind of beliefs govern how they govern their lives, their coping strategies, and how do they interpret events when they interact with the world around them? So that's the kind of information that we're trying to gather with clients. Sometimes social workers have had difficulty with the concept of assessment. For some social workers, assessments sort of imply that at the beginning you do an assessment and you figure out the client, and then the treatment follows afterwards. And the argument is that that's too linear. There's kind of A and then you do B. And there's some weight to that argument. We don't want our assessments of clients to be locked in right at the beginning. We do want our assessments to be evolving as we learn more about the clients. And one of the things that I appreciate with Judith Beck in her book is that she puts a lot of emphasis on the notion that we're always generating hypotheses, but we're also testing hypotheses. This is consistent with CBT. This is what we do with our clients. We're asking our clients to continually reevaluate their interpretation of situations and how they're reacting to those situations. So we want to do that same thing with our clients. We don't want to lock ourselves into a specific view of a client if the evidence is leading us somewhere else. However, with a CBT assessment, we do want to have a view of what the core problem is for a client so that we can establish goals and work towards those goals. CBT aligns itself fairly strongly with the DSM. The notion of creating a diagnostic impression of a client or a clinical impression of a client that has a lot to do with determining the types of interventions that we're going to do. What kind of treatment protocols are we going to follow? When we're able to establish a clinical diagnosis, then we have access to a large body of literature where people have studied and researched about what is the best way to treat those disorders. And one of the strengths of cognitive therapy and cognitive behavioral therapy is that it's worked very hard around what are the treatment protocols that best fit specific disorders. So I think that alignment makes a lot of sense within the context of CBT. For me, at a personal level, I found that learning to do assessments had a dramatic effect on the quality of my work. I noticed that when I became more structured about my assessments, where I was clearer about the information I was asking clients about, my dropout rates went down. Clients were more likely to hang on to me. In fact, as my career evolved, I had almost a no dropout rate from that first session onto the second session. One of the things that a good assessment does is that it gives a structure for a client to tell their story. Now, if you go in and do an assessment and it's just the checklist and you're going through a bunch of questions and you're checking it off on some kind of checklist that you have, that doesn't really connect with clients. But if you're asking questions that allow them to tell their story, that allow them to tell you their experience. And sometimes in an assessment, you're asking questions that they haven't really thought about, but it's relieving for them to be able to express that to you. So I think a good assessment actually helps build your therapeutic relationship. One of the other things that I think an assessment does is if you become good at writing up an assessment, it helps give you credibility with other professionals, particularly from other disciplines. I did a lot of my work in small communities, and it always sort of surprised me that when I would write up an assessment and send it off to, say, some doctor in Vancouver, I'd often get this kind of surprise response that, oh, didn't know you did such good work over in such and such a community. Now, I'm not bragging, and it's a little bit of an insult to rural communities to think that good work isn't being done. But it does give you credibility with other professionals if you can do good assessments, write them up, and add clarity to the case. One of the pieces of doing an assessment is being well prepared. So that means reading through the documentation, notes that other clinicians have made, reports that others have been made. Some clinicians have a hesitancy to do this. They don't want to be biased by the opinions of others. And there's some validity to that perspective. But I think when you don't access the other information from other people, then you limit yourself into what you can learn and understand about the client. And I think in this current day and age, it's expected of a professional that you would access other information that you have at your disposal. And to not do so and then to miss something that is critically important would reflect badly on your professional practice. So I think it's important to gather information together and prepare yourself before you see the client. Your initial conversation with a client over the telephone, setting up an appointment, I think is critically important. One of the things, and it seems like a very sort of basic thing, but just that friendliness, that warmth, that openness, letting a client know that you're looking forward to meeting with them and to seeing them, I think is really important. A lot of agencies feel a lot of pressure in terms of the volume of clients that they have knocking on their door for services and for help. And sometimes we inadvertently communicate to them that we don't want to see everybody, that we're overwhelmed, and that the clients are a burden to us. Or we become overly annoyed when they don't show up for appointments, or there's delays at the client end. And I think we have to be careful with that, because it's very difficult often for our clients to come and see us. When you think of the shame and the stigma that's involved in admitting that you have a problem and seeking out help, these are difficult barriers for our clients to overcome. And so you want to be adding to sort of smoothness and ease of access to services for your client. One of the things that's worth thinking about, depending on what kind of setting you're in, is whether there should be a medical referral and just sort of a physical medical checkup by a physician before you see the client. Many of the psychological kinds of problems and mental health problems that clients present with sometimes can have a physical component, or they may actually be experiencing some kind of other physical disease, diabetes, lupus, something else that's going on, where the symptomatology looks like a mental health issue, but in reality it's a side effect or a symptom related to some other medical condition. Now, just because a client goes to see a doctor and has a medical doesn't mean that that we can always rule out sort of the physical problems. We do know from research that our medical system tends to have a negative bias against individuals with mental health problems or a variety of social or personality issues. And so our system will often miss medical conditions because of their perception of the individual having a psychiatric problem, for example. So it's worth your while to be sort of aware of the possible medical complications that it can exist with the client population that you're working with. Because sometimes you need to kind of prompt physicians as well, or at least develop good relationship with some of the family doctors that you work with, so that you can kind of sort out and ask questions and get to the root of anything that's more medically based. One of the things that Judith Beck brings up in her book is the relationship with families. As social workers, we're interested in systems and interactions of an individual between their ecosystem, and that includes their family. And so there's the question of what role does the family play in an individual seeking therapy. Now, this is complicated because sometimes the family presents with a sort of a complicating dynamic. And the individual that we're seeing may not want the family to be involved, or they may want to say things to you, but they wouldn't say those things to you if the family was present. So you want to be able to give the client privacy, but at the same time there may be important supports that the family provides to the individual, or there may be some sort of issues that you may need to work on between the individual and their family. And so you having some connection with the family may be quite useful. Judith, I think, wisely suggests that you have a discussion about this, right up front, even in that initial phone call, just to say, are there family members that are supporting you? What kind of connection do you want them to have in your treatment? Do you want them to be involved? And so that kind of discussion, so that you can kind of be strategic in terms of how you use families, both in terms of protecting the client, but also developing and supporting the support systems for that client. So I think I'm just going to leave that for now in terms of the assessment piece of things. A number of thoughts that I hope are helpful for you to consider as you do assessments. I think assessments are just really important, and being able to do good quality assessments are essential for a good treatment, but also it's an essential part of building the therapeutic alliance with your client. So best of luck with that.